important to understand that many of these observations by the family members will help in a long way to diagnose an illness like schizophrenia. Is the person withdrawing himself, not talking to anybody, not taking care of one's personal hygiene, and also there is certain changes in their emotional state also. It could be anger, frustration, shouting for no reason, and sometimes some certain behaviors like even talking to themselves. They may be going through abnormal experiences, as in hearing voices, the suspicion, feeling that people can read their mind, or they are getting certain external controls for which they are unable to account for. Schizophrenia could well be one of the reasons for that abnormal behavior. Medication, as an antipsychotic medication, is the most important part of the treatment. There are varieties of antipsychotic medications available, and including injectable forms, which may be useful in some people who for some reason either are not so regular in taking tablets or who complain of other side effects, particularly like drowsiness, which may prevent them from taking. Called ECT, electroconvulsive therapy, which is also used when there are indications that the person either has suicidal risk or taking longer time to respond to medication, and who the symptoms are very severe. ECT also is a form of treatment which can be used with medication. When a person has a first episode, first time an illness is suspected, such instances hospitalization is important so that you could start the medication, you could stabilize, you can observe for side effects and see how they respond, so that acute or the immediate symptoms can be controlled well before they are discharged back to their homes. Now, if an illness has gone on for a longer time, where hospitalization alone is not enough, plus their skills, their occupational skills or their ability to get on with their activities, maybe like reading, doing their household work, or being socially withdrawn. So, such instances, it is worthwhile to consider rehabilitation. I think many factors will help in recovery. First and foremost, an early recognition of the illness, early treatment, going through counselling, making sure that medicines are given regularly, attending sessions, counselling sessions, a good family support system, support from the employers or where they are studying. So it will all help them to give that emotional and moral support so that they can recover much faster. Family can monitor the situation, can make sure once the diagnosis is done, once the treatment is initiated, that they are part of the treatment process. Of course, making sure that they don't stop the medicines, because the biggest reason for relapse is stopping medication. So the family has an active role in the person staying well. Society can provide looking at the proper adequate health services so that the illness can be treated much more effectively, provide with respect to proper mental health professionals who can understand and can support the individual. Having more understanding society, more understanding employers, more understanding family members will go a long way in a better prognosis, will go a long way in a person staying well even after the first episode of illness. Be alert to and aware of the early warning signs, the changes in behavior, emotions, in their productivity, which can be early signs of relapse. And the other thing is, with respect to being supportive, also one needs to be treated as an equal, not to be stigmatized. So you make them welcome, you make them feel that they are part of your family, and you provide the same love and affection and care, and you treat them as normal as anybody else in spite of the illness being there and being on treatment.